n'abandi abana batali mu busaho bariko abali mu bintu ebindi omwebembezi omulungi alole ekintu ekyakusobola nkyayizirindie kandi akimara zoramu akaba nakigamba kigambo n'abandi bakagize so nsobola kutakora buli kimu kyona aba resources ku bantu ekyo ninja kulengaho kuranga buli sector nagikwataho n'aba arts n'abandi for now ngenda kubanza kuziringira kusobora kandi ndole cyakora Bunyangabu in the next 5 years nija kubanekerayo mu Uganda yona kubina abantu abasomera ubusa so that's my target.
Honorable, let us get to
English.
Yes, honor is still on cancer. Let's get to cancer. Yes. Let us know how serious the issue of cancer is.
There is a very, very big outcry of people who are losing their loved ones to cancer. In English? Yes, cancer is becoming a very big problem, especially in Bunyangabu. As I was telling people, in the last 1 week, we have buried over 10 people in just one small county. We have over 49 people on palliative care, and yet many people here do not do medical checkup, meaning there are so many people who are sick, who are suffering from cancer. So I am calling upon the Ministry of Health, I'm calling upon the government to intervene, different universities to intervene and do research and find out what is causing cancer in Bunyangabu. I am just thinking, maybe the water we are taking, in Exarunka we have a river like in Tabago that is very dangerous. So I think maybe because we are taking water from Crater Lake or from such rivers or because of environmental changes could be some of the causes of these cancers. That is why I'm begging the government to intervene, do research, find out what is it with cancer. Uganda is known for fighting pandemics, for like Ebola, like COVID. I am sure if the same attention that we are giving to COVID, that we are giving to Ebola can be given to cancer, maybe we can prevent, we can control, make sure that such solutions are found.
Well, Honorable, let us know the accessibility to health services here in the region. What is the nearest area these people can go for checkup?
Of course, we do not have a cancer center here, so many people do tests from Fort Portal, which is about I think 20 kilometers from here, and we do not have a cancer center. I would request government to probably consider having a cancer treatment center in Bunyangabu so that people are able to access these services as quickly as possible.
Chairman,
Thank you. Chairman,
cancer. Make your thing. We have seen that there are so many accidents that are happening on this road, especially in Kasumanyanga.
Yes. We have a very, very huge problem in the Bunyangabu of the road, especially the Kasunganyanja stretch, where we are almost losing a person per week, and it has been going on for years. I am calling upon the government, Ministry of Works, to get a solution as soon as possible. Kasunganyanja is a death trap, and thousands of people have lost their lives there, so we are really requesting the government to intervene. The chairperson LC5 is here. You'll also make a comment about it, but it's a very big challenge, and I think ministry should intervene as fast as possible.
Okay. Thank you so much. Now, Chairman, we shall have you
Bunyangabu, we are actually in trouble with cancer. The cancer cases have increased. The barriers we are making, the majority of cancer cases. So that's the reason why I directed the DHO to do a thorough research and report back to the District Executive Committee by the close of this week, Friday. So I'm expecting a report from the DHO so that we can be guided on how best we can talk to our people. Secondly, we are also rolling out mass communication to the community. There are basic practices which we are encouraging our people to do. The types of foods to eat, carrying out some routine checkups, like for cervical cancer, men to go for prostate, those who are above 40 years. So the intention is to have early cancer detection and
Success, yeah.
Chairman, the road.
No, before the road is chairman, let us first know when did you realize this problem was in this area, and what age groups are the people that are dying of cancer?
The cancer has been around. I have been a chairman in NRM for the past 5 years. We have been seeing that growth in the cancer cases increasing. But now we see it is almost doubling. And the age brackets part is very surprising. Initially it was in the old age. But now we are seeing children also being affected. If you go to Mulago right now, Bunyangabu has more than 20 cases of younger children suffering from cancer. So the reason why I'm directing the health department is to look at what kinds of cancers we have. Are they related to the living conditions? Are they related to water? Are they maybe the sprays they are making for the agricultural products? So we want to take interest in the types of cancers so that we can have these interventions.
Okay. Now about the road.
The Bunyangabu road is a real menace to Bunyangabu. It has been a problem until UNRWA had an intervention to have a resting place at the Kabali. Near the church, there was a resting area where these lorries, the lorry drivers would make a stopover. The then ED UNRWA, called the Gina, had come and met the district leadership, had mobilized the landowner to have a stopover. But unfortunately, the landowner saw government was not coming in, maybe to compensate them, chased away the lorry stopover point. So my appeal is to Ministry of Works to gazette an area where these lorry drivers would first have a rest. You know, most of them are from Kenya, they are moving to DRC, and the lorries have issues. But when they rest, and the drivers rest, then they check on the mechanical conditions. It had reduced on the accidents around Kasunganyanja. The second option is having a diversion. As you reach Kabale, we had proposed the diversion which moves inside the Kitonzi, then it goes up to Ruimi. It bypasses that hilly area. So we need to have a meeting and engagement with the Ministry of Works on these two solutions. The quicker one is having a stopover. The long-term one is having a diversion. Then the last one is working on the roundabout of Ruimi Town Council. Our proposal is we should have an exit route in the middle of the roundabout. So these lorries which succeed in negotiating the corners of Kasunganyanja, when they reach Ruimi Town, they should proceed and continue with the main road instead of moving inside the town of Ruimi where they've been causing more accidents. So I call upon the Ministry of Works to come quickly and intervene and help so many lives we are losing in Bunyangabu. Then lastly, on the bursaries, we appreciate what Honorable Victor has done. As a district, we commit to give support by following up the learners working with the parents. But above all, we promise, as we pledged, to reduce, to cancel out, eradicate, abolish the selling of jobs. Our intention is these learners, after they qualify, we shall avail the opportunities, they come and they do the interviews and access government jobs without paying any money. It is a crisis, it's also another cancer, which we are going to fight until we abolish it in the district.
Thank you so much.